Hi, my name is Rachel Sage McCafferty, and I'm going to be demonstrating a hair, skin, and nails, head, eyes, ears, throat, and head, eyes, ears, nose, throat, and musculoskeletal and breast and testicular examinations today. So the very first thing that I would do was be to check my orders, and I see that Sam Smith here is due for all these assessments. So next I'm going to gather my supplies, and I have oil of lavender here as well. That is to test the patency of the nose, and then I have a pen light here that is going to help me inspect the eyes and the nose as well, and test the eyes. All right, I'm going to go to the patient's room now. I am washing my hands with hand sanitizer as I walk into the room. I'm providing privacy by pulling the curtain, and I'm introducing myself. Hi, my name is Sage, and I'm going to be your nurse today. Can I please verify your name and date of birth? He said his name and date of birth, so I'll check his bracelet. They match. So, Mr. Smith, I'm here today to do a head, hair, skin and nails, and eyes, ears, nose, and throat, and musculoskeletal assessment. But I will also demonstrate to you the breast and testicular examination so that you can do those at home. Now, this may take about 30 minutes, but we'll go ahead and get started. I have gloves here that I'm going to put on before touching the patient. I'm going to start by inspecting the skin. I can see that his skin is evenly distributed and is the same color throughout, and it is appropriate for his race and ethnicity. It is also, there are no visible signs of erythema, no lacerations, bruises, or ulcers, I'm not seeing anything wrong. Next, I'm going to palpate the skin. It is smooth and it is warm bilaterally on all extremities. It is moisturized, but not perspiring or not dry. Next, I will check for turgor. So turgor is checked by pinching the skin, and it should return to baseline promptly. Next, I'll check for edema. I'll check around his ankles, and by pressing in, there's no pitting. So I'm not seeing edema present. Okay, next I'm going to move on to the nails. The nails seem to be clean and trimmed, and the edges are smooth. The nail itself is smooth, and I'm not noticing any brittleness. It is slightly rounded, but not clubbing, so it's about at a 160-degree angle. I'll check for capillary refill. I'll do this by pressing on the nail, and it should blanch at first, but return to its normal color within 2 seconds. Next, I will inspect the head. It is normocephalic and round. I'm not seeing any indentations or masses. I'm not feeling any indentations or masses. There are no nodules, there are no protrusions. Next, I'll inspect the hair. The hair is thick and well distributed. It is well lubricated, but not excessively lubricated. There's no vermin, no lacerations, no scales, or anything else. He's doing good on his hair. Next, I'll look at the face. The features are symmetric. They are lined properly. I'm going to palpate the frontal and maxillary sinuses. So the frontal sinuses would be here, and the maxillary sinuses are here. And I'm noting no tenderness. There's no tenderness. I'll next palpate the lacrimal apparatus. Do this with my index finger right here, and I'm noting no exudate or tenderness, or no discharge. So next I'll look at the eyes. The sclera is white. I'm going to pull down on the eyes, and the conjunctiva is pink and moist. Next, I'll assess for pupil reaction. I'm going to do this by putting my hand in between his two eyes and moving inward with the light. Okay, the pupils are equal in size. They both react to light. They're both accommodating to the light. And next I will check, okay, so also the red reflex. Whenever I'm looking into his eyes, I'm looking at the back of the eye, and this should be red throughout. I'm not noticing any dark spots, and it looks like it's intact. Next, I will check for nystagmus with the 6 cardinal gazes. I'm instructing my patient also with checking the pupils with the light. You want to make sure that that person is focused on a distant object. But now I'm going to check the 6 cardinal gazes. I'm going to instruct my patient to keep his head straight and only follow me with his eyes. So I'm going to start by going in this direction, and then up. So the first is diagonal, and then this one is down, and then left to right. And he was able to follow all of those, not noticing any nystagmus, so that's good. Next, I'm going to check the ears. So upon inspection, they are symmetrically aligned. They're proportionate to his head. The pinna, upon palpation, is not tender. And since Mr. Sam Smith is an adult, I would pull his ear up to inspect the inside. I will do this. The auditory canal is free of debris. There is no excessive wax. There is no exudate. I'm checking for the cone of light. I'm able to kind of see the tympanic membrane right now, and it is pearly white, and the cone of light, because we are on the left side, is about 7 o'clock. And on the right side, the cone of light is at 5 o'clock, which is appropriate. So next, I'm going to check his hearing. So I want to know if he can hear. I'm going to do this by doing a whisper test. So I'm going to ask him to cover his opposite ear, and then I'm going to whisper 3 unrelated words and see if he can recall them. I'll do that on both ears. Next, I'm going to look at the nose. It is proportionate. The nares are symmetrical. Next, I'm going to use my pen light. The mucous membranes are pink. They're intact. There's no exudate. So his nose is looking good. Next, I'll check for patency. I'm not going to show him what this is. I'm just going to bring it over And I'm going to ask him to close his eyes and cover one of his nostrils and tell me what he smells. Okay, he said lavender. I'm going to ask him to do the same thing with the other nostril. And he said lavender. So next, I'm going to look at the mouth. First, I'm going to just ask him to say ah. That'll help me just see a lot of things all at once. So the lips, the mucosa, gingiva, tongue, and the pharynx are all pink and moist. I'm not seeing any lesions. Looking inside, there's no bleeding or cyanosis. I'm going to ask him to open again and say ah. There was a rise and a fall in the soft palate. The uvula is midline. The tongue is midline. The indentation is all straight, is white, is clean, and there are no loose teeth or no missing teeth. So next, I'm going to do the neck. I'm going to do this by getting behind Mr. Smith. So to do this, I am going to first look. There's no erythema. There are no bumps, no nodules, and I'm feeling, and I'm not feeling any nodules, and I'm not seeing any erythema, and the neck itself is pretty supple. I'm going to check his trachea. It is midline. There's no crepitus or rigidity. I'm palpating the thyroid, and upon palpation of the thyroid, I cannot feel it. So next, I will go into the lymph nodes. So I'll demonstrate the lymph nodes on myself. Leave my gloves on. Okay. So we have pre-auricular here, posterior auricular right here. Then we have occipital back here in the base of the head. And then we have submental, submandibular, jugulodigastric. And whenever I'm checking jugulodigastric, I am also going to check his TMJ, his temporomandibular joint, for any crepitus or rigidity. And I do that by asking him to open his mouth and then close his mouth. And then, so again, assessing for rigidity or crepitus. Okay, and then after jugulodigastric, we have superficial cervical. So superficial cervical right here. And then we have the deep cervical chain. Then we have posterior cervical. And then we have supramandibular. So those are all of the lymph nodes. Then next we're going to move into musculoskeletal. So I will do this by asking Mr. Smith to stand up. First, I will check for his overall posture. He is, able to stand up straight. Upon looking at all bony landmarks, everything is symmetrical. There are no protrusions. All of the skin over the joints is about the same color as the rest of the body. So everything is looking symmetrical when he stands. When he walks, I'm noting that his gait is steady. He's not swaying side to side. And asking him to do a heel-to-toe walk, he is able to do that without losing his balance. So his gait is good. Then I will do a scoliosis check. So when he's standing up or sitting down, either way, we'll do the sitting down. I'm going to put my hand on his back, right below his neck, kind of in between his scapula. and ask him to lean forward. And as he leans forward, I'm checking for that spine to get really rounded, which would suggest scoliosis, but nothing, everything seems fine. His spine is centered in the middle of his back and is straight. So next I will assess muscles. We'll start in the head. I'll demonstrate. So for the muscles in the head, you're going to want to ask them to look down or to flex, look up or extend, turn to the right, turn to the left, and he was able to do that with ease. Next, I would check for the strength of the neck, or the head strength. I would do this by putting my hand on one side of his face and ask him to press against my hand, or I'm sorry, I would press against his head and ask him not to move. So I'm doing opposing force. I would do this on both sides. Then I would check the shoulders and ask him to shrug his shoulders. He can do that with no problem. And then I would apply force and ask him to push up, and then I would assess the strength. And so we're assessing all these things bilaterally. So strength was good in both shoulders. Then I would assess arms. So I would be doing this by asking them to abduct, adduct, supinate, pronate, circumduct the wrists, circumduct the arms. And then I would do that bilaterally. And then I would apply force and ask him to push out. And then apply force here and ask him to pull in. And he should be able to do that on both sides, which he was. Next, I will assess the hips. So for the hips, you're going to do about the same thing as you did with the arms. You're going to abduct the leg, adduct the leg, circumduct the leg, and then I would do opposing force to this, to the leg as well. And next, I would do the ankles. So if his legs were, dangling on the side of the bed, I'd ask him to flex, extend, so this is dorsiflexion and plantar flexion. And then I'd ask him to circumduct his ankles as well. Also testing opposing forces. So I would put my hand under his foot and ask him to push down, and he could do that. And then same thing, ask him to pull up as I press down. Also, I would assess grip strength on both hands. And now, I would do that by crossing my arms so that I can accurately note which side was stronger, because it would be the same as my left and right. I ask him, okay, so with this one, I would put my fingers in between his hands and ask him to squeeze. And if both sides squeezed with the same strength bilaterally, then that would be really good. I think that does it for musculoskeletal. We will move on to breast and testicular examination. This would be something that I would teach to my patients, as well as in general I would be able to do an assessment, but I cannot right now. So with the breast exam, we're going to instruct women to do this with both exams, with breast and testicular. We want our patients to do this once a month. And for the breast exam, women should be doing it around 4 to 7 days after menstruation. And then for men, for the testicular examination, you would want to recommend them to do it either during a shower or right after a shower, because everything is a little bit softer after that. So you would do the breast examination by going in a vertical striped pattern across the breast, making sure to get the tail of Spence, which is right here, because that is a site of a lot of cancer. So it's really important to remind them to check here, because they may not generally think of that as being their breast, but it is part of the breast examination. You would want to ask them while they're going in the vertical striped pattern to make sure that they're using 2 fingers or 3 fingers for the breast exam, and then kind of moving in a circular motion as they go up and down the breast tissue on both sides. You're going to ask them to note any lumps, bumps, nodules, areas of tenderness, and then also to check the nipple and the areola to kind of like to pinch it and to note, or lightly pinch it, but to note any unusual tenderness or discharge. So that is important for the breast examination in total. Also, you would ask them to lean forward to check their breasts to notice any dimpling or retraction. That would be something that would be really important to notify their doctor about, on top of all of the other things. For the testicular examination, so yes, the men should be doing this once a month, as well as the women doing their breast examination once a month. So you would take your thumb and your first 2 fingers to palpate the testicles, and it is important to note with both breasts and testicles that asymmetry is pretty common, but to note any changes in symmetry if they do occur. Also for men, the testicles, it is common for one testicle to hang lower than the other one, but also to note any changes. But to palpate the testicles, you want to take your thumb and first 2 fingers and just kind of go in that same circular motion, but in a vertical striped pattern across the whole testicle. Now, the epididymis is normally palpable, and then moving posteriorly, so that's the top anterior part of the testicle, and then the posteriorly, the vas deferens. So you would also be able to possibly palpate this too, but these structures should feel spongy. They shouldn't feel rigid, or there shouldn't be any nodules or anything. So that is really important to report to the doctor if a patient does, discover that in their own self-examination. And also, men should alert their doctor if there is any swelling in the testicles or if there has been any blunt force injury. So that concludes our assessments today and the demonstrations. Thank you very much, Mr. Smith. You were a great model for this video. I'm going to return the bed to its normal position, to its lowest position, making sure that the side rails are up. No more than 3 side rails can be up without a doctor's order, because 4 rails up is considered a restraint. So I'd return the bed. I'd assess for any more client needs. Mr. Smith, is there anything else that I can get for you? He says no, so I'm putting his call light within reach. Please let me know if there's anything that you need while I'm gone. Just press your call light, and I will try to get here as soon as possible, but I will be back in about an hour to check on you, or about 30 minutes to check on you. And I'm going to clean my equipment. I'm going to dispose of my PPE properly. I'm going to wash my hands. and I'm going to document the most important. No, I'm just kidding. But I'm going to document. So making sure to note the date, the time, the patient's response to the procedure, and anything that I noticed that was abnormal. Thank you very much for watching my video today. That concludes everything.